Before I start, I do want to take a second and thank you. I know how busy everybody is in their day-to-day lives, especially taking time at the evening from your family. So for you to be here means a lot to me personally. I'm the president and founder of the Fatty Liver Alliance, and we've been a charity for about a year and a half, but about 2.5 years we were a non-for-profit before that. So thank you for coming. This is actually kind of a pilot because if you guys love this, we're going to do more of them. And we can do them across the country. So, please let us know. I'll talk about the intent of tonight in a second, but I want to start by thanking, we had some sponsors. First of all, the Canadian Institute of Health Research gave us a grant, that's a Canadian grant, and they're very focused on health in Canada. So I greatly appreciate the support that they've done. Westmount Public Library, of course, because they're letting us come today and helped us also with the healthy food. And so thank you, Danielle and team. Novo Nordisk, Inventiva, Siemens Healthineers is over here. So they make a blood test that can be used to determine your liver health also. So feel free to come over and speak later. And we also have KNS Canada. And do you know that we're also offering a liver assessment tonight for people? So we have a few spots available based on the time that we have. So I'll explain way more about that later, okay? So what we're going to do today is I'm going to start and just give you a little bit of background about Fatty Liver Alliance, just so you know who we are as a charity. If anybody on LinkedIn specifically? No LinkedIn people in this room? Oh, yeah, I want 2, thank you very much. Follow us. Facebook and Twitter also. And then I'm going to tell you a little bit about my background and why this means so much to me as a liver disease. And then after the 2 doctors, Dr. Sahar Saeed and Dr. Giada Sebastiani are going to talk, then I'll talk about what we feel about is next and a little bit about 2023. So first of all, the Fatty Liver Alliance is based on these 4 pillars. And we want to raise awareness. Most people don't know anything about the liver at all. And it's kind of scary because it's really, from my opinion, maybe I'm biased, I've been in the liver space for about 30 years. It used to be hepatitis C before. I worked in the pharmaceutical industry before. And so a lot of people don't talk about the liver. They do talk about other cancers, not specifically liver cancer. They talk about heart attacks, cardiovascular, breast cancer, but liver is just not mentioned a lot. And so it's really important that we do things like this. So the awareness is a really important piece of it. The education piece is also what we're doing tonight, having the specialists here and myself to share our experiences. But physicians also have to learn. I was just on an event today with the FDA, and there was like 2 days, yesterday and today, of presentations to physicians too, and to the FDA, so that they can understand about liver disease. So it's a really important area. I wanted to add too that the topic of tonight, part of the topic is about fatty liver disease, and about 40% of Canadians have it. And that number goes back and forth, 30, 40, it might even be more because we haven't tested every Canadian to really know. And the research piece of it, of course, you're going to hear about studies that have been done in Canada. And it's really important for us to continue to support that. And both for Dr. Sebastiani and Saeed, we've done work with them and helping them publish to support other things that they've done. So we want to continue to do that because we have to continue to help Canadians know more about this important area. And the advocacy piece is about, I'm going to tell you a story in a couple slides from now, but we went to Ottawa and they had never discussed the liver before. All the other issues they talk about in Ottawa, and nobody ever talked about liver. So being there to fight for families and patients now and when treatments are available shortly to make sure that patients who find out they have liver disease actually have approved care that they need. And for now, there are other things, and Dr. Sebastiani is going to talk to you about that, so you'll have a better idea. This is an example. So this was in Ottawa, and a group of us went with and under the umbrella of the Canadian Association for Study of Liver Disease. You both were there, right? No, Giada was there, Sebastiani was there. And so we met with senators and MPs and talked to them about liver disease and fatty liver disease and hepatitis and other areas as well, and liver cancer. This is actually Richard Betel. He's an MP from Quebec. He's having his liver scanned, which is what we're offering tonight for people for free. Probably the waiting time for a lot of clinics is about 6 months these days, which is really sad, actually. But so this MP volunteered his time to be able to do that and to sort of lead by example. There are at least 100 liver conditions: fatty liver disease, NAFLD, non-alcoholic fatty liver disease, and now called steatotic liver disease, same thing, and non-alcoholic steatotic hepatitis, big words. It just means there's fat in the liver, and then eventually, if you don't do something about it, scarring comes, and then you might need a transplant, or possibly even death can come from that, which is why this is so important. So we're doing what we can to try to prevent disease by early diagnosis, letting people know about this disease ahead of time, and so that they can test for it. And by the end of tonight, you will clearly know what risk factors there are in your own families and what to look for, so that you can go to your doctor, who probably has a million things on their plate, and say, I have these 3 risk factors for fatty liver disease. I would like you to assess me, please. And they will do it. If you don't, they will talk about a lot of other things, unlikely that they're going to get to the liver because they're so busy doing so many other things in their practice, as you all know when you go see your physicians. So just a little bit about my background. In my family, I have all of these, and now they're not even calling it risk factors, now they're calling it comorbidities. That's the latest term. So there are other disease states that people have that will be an indication that they also have a problem with their liver, with specifically fatty liver disease. So obesity, high BMI, type 2 diabetes, sleep apnea, cardiovascular disease, high cholesterol, and also kidney issues, kidney disease. All of those are part of what's known as a metabolic syndrome. They're all interrelated. I don't know if you've thought about that they're related, but well, everybody dies from the heart stopping eventually. But the heart is what's talked about the most. Oh, they had a heart attack and they died. But they're not going to go back and go, oh, wow, this person also had really serious liver disease, unless they do an autopsy. But we know a lot more now, and we have the tools available, non-invasive tools available, so that you don't have to always have a biopsy to find out whether or not you have this disease or not. So my father, he was a pharmacist for about 50 years. He passed away just over a year ago in September. He had prostate cancer, stage 4 actually. But I don't believe he died for that, because he had all of those other metabolic issues. And when he was in the hospital, and they could have actually surgically removed the prostate cancer from some areas, he couldn't go on dialysis because he had kidney disease, and they also had cardiovascular issues. And so it just makes your body messed up, because all of the things are happening almost always at the same time. So we really need to sort it out. The solutions that you're going to hear tonight are going to help you and your family for sure, but they're not easy to do. They're not easy. Watching what you eat is one of those things, and it's like I fight it every single day, and that's why we went out of our way to get healthier choices here tonight. So 30 to 40%, I'm going to say it's probably even higher than that, and about a quarter of those people are going to develop very serious liver disease, and you'll hear more about that a little bit later also. So what can you do about it? So I found out, I thought, since I'm leading this organization, I should actually get myself tested. I did the same test that we have here for a fiber scan, and it was like, oh my God, are you kidding? It turned out that I had, and I'll show you in a minute what the results are, but that I had like a very high level, a high stage of fatty liver. I did not have NASH, so that was good. I didn't have any scarring, but I had fatty liver. So I said, okay, I have to do something about this. So I started walking a lot more. At least an hour a day, sometimes even more, 2 hours. I tried to cut out sugar wherever I could. So of course they hide it in everything. It's in ketchup, it's in sauces. I had an omelet a week ago, and they gave salsa, and I go, is there sugar in this salsa? And she goes, yeah, we had sugar. I go, why do you add sugar to the salsa? Because it tastes better. I said, okay, well, that makes sense. And by the way, there was just an article out a couple days ago that said that sugar is a real addiction. And it's in more and more foods, and foods that you eat are becoming sweeter and sweeter and sweeter, because our tolerance for sugar and sweetness is increasing. So you need more and more and more. And they did this on mice and rats, and they actually went into withdrawal when they didn't have the sugar. So I reduced the sugar, I reduced the carbs, because that carbs turns into sugar. I wore a glucose monitor. I'm wearing one right now, actually, voluntarily, because I don't have type 2 diabetes, and I wanted to learn how do all these foods interact with me, because I'm like, I know it's me, and you could look online and go, hey, well, if I have a piece of cake, I know that's really bad, but what if I have like shakshuka, you know, with the tomato and the goat cheese and stuff like that, and some things have no impact. Popcorn for me is terrible, for example. I had one cookie the other day and went like it was really high. So if you get the chance to try one of these, they're not covered, unfortunately, unless you have type 2 diabetes, but I find it very invaluable. I think even Costco has one that you can get for about $80. And I lost about 10 pounds. So what? So this is what the FibroScan readout looks like. This is called the CAP score. I guess you guys might mention a little bit about that too. And so this is the fat score, and this is the scarring score, the 3.9. 319 is really bad. How bad is 319 for fat? It's bad. So I was worried about it, and I wanted to improve it. The 3.9 though for the scarring is actually really good. They said, oh, you don't have anything to worry about because you just have fat. So, but I did. I just showed you what I did. And then actually, just over a year later, I went to 250, which is really good, and 3.3, which was an improvement on what was already good. So you can do it without prescriptions, without pharmaceuticals. But again, you have to walk, you have to watch what you eat, and it's a journey. It is not a one-off fix. And I don't know, if I have time, I'm going to get mine tested again today too, because it could go back up again. If you go back to eating the stuff you know you shouldn't be eating, because nobody's watching, it'll go back up. So why are we doing all this? So the CIHR that I told you is one of our sponsors. This is what they want. They want interaction between researchers. So both of these two other speakers are researchers and you. So anything that they learn, anything that researchers learn and can share with the public means that the research is going a lot further. So it's not just with the medical community, that the everyday people, patients, the community can learn about it too. And then even further, they want to have an interactive session. So that's what today's about. It's not just a didactic, okay, you came, you ate, you listened to talk, and you go home. I really want people to ask questions and not to be shy. And we're trying to set this up. It's called a Café Scientifique. So you can have this. I couldn't make a cafe. We need some music, maybe it would help it. To make a casual atmosphere so that you feel comfortable to ask the two speakers tonight or myself about anything you want to ask, and we'll be happy to do that. And the other part of this is CIHR wants to take your ideas and turn them into clinical studies so that we can do more research and learn more for future studies. So on your chairs, this is really important. You won't be able to read it too well from there, but that's okay. You have a copy in front of you. Super important, please. I'm asking if anything that you do tonight, fill this out before you leave, because CIHR, who was kind enough to give us funding to do this, need to know if these are worthwhile, what you got out of it, if you thought it was good, or do you have suggestions, if you can put it in there. But I'll just really quickly go through this so you know what you're doing. The first question just says, who are you? Probably most of you are public audience. The next question says, rate your overall satisfaction with this whole event. Obviously, you can't do it yet. And if you're unsatisfied, then share that too. Was the program objective achieved? And that's basically creating opportunities for all of us to talk about what I just talked about, to have that interaction and to share ideas. And if you responded no, please put no. Was the information or comments shared for the following groups? So the researchers that were here, I'm a knowledge user because I'm a patient myself, and I take the research. You are all actually knowledge users too, because you're going to take what you hear tonight and apply it to your families, and then audience. So pick one of the areas and respond to that. Were the topics about equity, diversity, and inclusion covered? That may or may not include Indigenous rights, but it's on here. And the ninth question is, what would you do to improve events like this? Would you be interested in attending another Café Scientifique in the future? It could be a different topic, by the way. Would you recommend attending this to family and friends? And the last question, is there anything else that you'd like to share? So it's like 2 or 3 minutes of your time, and it means a lot to me and the people that helped put this together. So finally, I want to introduce the two amazing speakers. I know them like people too, not just presenters. Sahar Saeed is assistant professor at the Department of Public Health Sciences at Queen's University. I'm going to look so I don't miss something. And her specialty is epidemiology. So she looks and does research about policy evaluation, health outcomes, disparities, and knowledge translation. So like I said, taking information that comes in studies and sharing it so that people can actually benefit from it. And you can read the rest yourself, but she focuses on areas like HIV, AIDS, hepatitis C, COVID-19, chronic liver disease. There's her own website if you want to jot it down. I'm sure she would love to have you follow her. And Dr. Giada Sebastiani, also a fabulous person, one of the most passionate people, let alone physicians, that I know for sure. And it could be her background, I don't know, she'll tell you herself, but she's just fun and cares so much about her patients. So you're so lucky to have her here to be able to do this almost one-on-one kind of talk too. Her research is about screening for liver fibrosis and which you'll hear about what that means, fatty liver, people who are at risk and why, including HIV positive patients, diabetes, obesity, women with polycystic ovary syndrome, patients with inflammatory bowel syndrome, and clearly Dr. Sebastian has done a lot of publications. So, too much to start? I had to tell you everything. So those are the rules of the game. Now let's enjoy